Welcome to the Conduent presentation webinar on CommunityVision, expanding the view from hospital to community. Now let me introduce our presenters for today's webinar. We have two very talented members of our Conduent team. Jane Chai is a vital team member of our Conduent Healthy Communities Institute and brings with her a long list of experience within the public health field. Linda Justice is our nurse executive with Conduent Healthcare and brings a long history of clinical experience and knowledge to our team. Linda will be starting us off in our presentation. And again, thank you all for joining. Linda?
Thanks, Nancy. So many of you today joined our meeting from an invitation you received. So let's cover a little bit about what we're going to do with our time together today. We're going to talk about expanding that view from inside your hospital in a community out to your community setting. So where are we today? What does healthcare look like today? It's changed a vast amount in the years I've been in healthcare. What challenges are we currently facing? How do we meet those challenges? And what can we expect of the outcomes in meeting those challenges? So, like I said, many of you received an invitation, a lot of you because you are our DataVision clients. And the offering today that we're going to talk about, CommunityVision, makes use of both the data elements within our Healthy Communities Institute and the data within DataVision. So you may not be a hands-on user of DataVision. So you may go, okay, so what's the tie-in here? And so let's talk just a second about DataVision. DataVision is your benchmarking tool. It lets you track, analyze utilization patterns. It's what you use in performance improvement to look for those outliers and those opportunities. It identifies patient safety issues around poor outcomes. You may even look at some of your coding to make sure that your risk adjustment is accurate. Of course, don't forget those readmission penalties. We have a specific section set out that allows you to look at your penalties for readmissions up to 2 years in advance. And this is also your tool that your organization uses for regulatory reporting, such as core measures, value-based purchasing, hospital-acquired conditions, and other regulatory data. One thing you may not be as familiar with, but is available in DataVision, is our ambulatory measures that lets you look at outcomes for patients who are not admitted inpatients. So, Jane, let's look at those health outcomes. Wow. What are the determinants of population health? This one is something that I have felt for a long time, but love to see it here in print. Only 20% of health outcomes are attributed to clinical care. So all of you caregivers on the line, you case managers, your quality professionals, only 20% is attributing clinical care. So what do we do about the other 80% that determines the health of our population? As you can see, it's around social and economic factors, health behaviors, and even your patient's physical environment. So let's talk about where we go for monitoring this quality. So beyond just doing that monitor, many of you have felt like you've just maximized those performance and quality improvement efforts using tools like our value-based purchasing calculator, but you still aren't seeing the outcomes that you would like to see. This is compounded by the fact that 12% of patients are reporting a new or worse symptoms within just 2 or 3 days of discharge. Over 25% of Americans live with a disability caused from a chronic condition. This really brings over our focus to care needs and monitoring after leaving acute care. Jane, let's look at what it means after acute care. What is the impact? Well, penalties. We are all very well of the fact of those readmission, those complication penalties. It seems like the hospitals just can't get ahead for being penalized. Also, looking at disparities. We've all heard the news and events lately, and it's not just disparities in our communities. That disparity reaches all the way into the care people are receiving. And what about the market out there? There's pressure from all sides. You want to be competitive in the market, but you're still struggling on how to meet your community's needs, but then you also have to remain profitable to keep the doors open. You're doing all of this with a limited set of information. Your health records only provide you with information of the patients that have already been hospitalized in your acute care settings. But as we saw in the previous slide, 80% of the impact to a lot of those penalty-based measures happens outside of acute care. So this is a quote that really rings home to me. Dr. Regina Benjamin, our former U.S. Surgeon General, your zip code is a better predictor of your health than your genetic code. Let that sink in for just a minute. You know, a lot of us go out there and you see all these reports about 23andMe and Ancestry and all these other things. People really trying to find out what that secret sauce is around health. And look at this, your zip code. Have any of you really thought about where you live is a better predictor of your health than your genetic code? So we've talked about where we are in healthcare. We've talked about our challenges, those penalties. Now let's focus on what we're going to do to meet those challenges. So I want to acquaint you with CommunityVision. We have to begin to think outside the walls of our hospital. We see how much of that care is moving outside the walls, but we still have such a tunnel vision into what those outcomes look like. Our CommunityVision is a customizable platform that takes that internal acute care data, that patient data, and integrates that with community data, those social determinants of health, and all of that data that's not healthcare build coded data that you have no availability to now. We are a top data integration leading platform in community health. We have over 12 years experience in monitoring health of the community. We've got 25 plus years of experience of healthcare in the acute care arena, and we bring to bear to you over 5,000 metrics on health, social, determinants of health, and demographic type data. So what capabilities does CommunityVision really support? Well, we talked about that data integration, acute care quality metrics, those 500 plus metrics, the ability to see the impact of that community on your health outcomes that you're being penalized for. But that's not all. It also lets you analyze those social determinants of health, incorporating that acute care data, and analyzing your market. Where can you build your market? Where can you grow and be profitable? How do you look at this and look at it visually while still tracking those key performance metrics? And we alluded to some of those health inequities. This robust community-level data set and data visualizations lets you begin to be aware of and then to address those social determinants of health that's got that 80% impact on your outcomes that's causing your penalties. Along with this, our CommunityVision also encompasses those advisory services to help you understand how do we begin to get our hands around what is outside of our community. So Jane, I know you've got just a tremendous expertise and background in public health. So why don't you walk us through a little tour of CommunityVision?
Thanks so much, Linda. And yes, I spent a bit of my time in public health, and I have to say I'm so excited to be talking to you about CommunityVision today. When I was at the health department, I would often talk to my colleagues in the healthcare sector, and we talk about how great it would be if we could integrate our data sets. I think we each felt like we had a piece of the puzzle, but weren't able to put those pieces together. And I really do think that CommunityVision puts those pieces together. And as Linda mentioned, CommunityVision weaves together Conduent's data vision and Healthy Communities Institute solutions. For those of you who aren't familiar with HCI, we are part of the Conduent family, and we've been a leader in community health field for over 12 years. And we're known for our award-winning community health platforms that have been implemented in over 100 communities. We've also conducted hundreds of community health needs assessments and provide guidance on strategies to improve community health to hospitals, health departments, and community collaboratives across the country. So let's dive in here so you have an idea of the look and feel of the platform. First, please note that I'm showing you a demonstration site. Bayview Health and the acute care data we'll be showing today is made up for demonstration purposes only. This is an example of a landing page of our platform. It's customizable so it can reflect your branding and feature what you'd like on the homepage. That may mean that what you feature on this homepage changes over time as your quality or community health priorities shift. From here, you can easily navigate to our dashboards, reporting tools, and library of promising practices. The platform features dashboards that host a range of health and social determinants of health indicators. This includes around 50 acute care quality data from DataVision. And as Linda said, because 80% of health is impacted by what is happening outside the walls of your hospital, your CommunityVision platform will also include more than 500 community indicators that provide insights about the communities where your patient population reside or work. This includes community health indicators around health and health behaviors such as obesity, diabetes, and binge drinking. There are also social and economic indicators such as health insurance rates, educational attainment, or households with an internet subscription. The dashboards allows users to scroll through and see trends and comparisons to local, state, or U.S. values for all of these indicators. We use simple visualizations that are easy to understand. For instance, throughout the platform, green means good and red means bad. So it's easy to identify where things are going relatively well and where things are falling behind, both within your patient population and outside the hospital walls. Here you're seeing a dashboard for a zip code showing that average expected charges due to heart failure and heart failure readmission ratios are higher compared to the county and the state. What you're seeing alongside these acute care data is community data showing that almost half of adults in the zip code are sedentary, a third live below federal poverty level, and the majority are spending more than 30% of their income on rent. Linda, can you talk a bit about the value of this type of dashboard in a hospital setting?
Yeah, Jane, you know, I spent many years of my career working inside case management and working in quality and really struggling on things like those readmissions. And when I pulled up my internal quality dashboards, what I saw was the work we were doing internally and talking to patients and family and planning for discharge. You know, I did the best I could with the information I had, but, you know, if I'd had a tool like this that didn't just take some of that state data that you have ability to call the state and get, but could really bring that data in, even down to the community and the zip code level, but overlay my hospital's performance on that. So I see the real impact of our performance improvement, our work, but look at that with that visual set that says, wow, okay, I've got a high heart failure readmission rate, but my patients from this area that are sedentary and they're living above poverty and spending a lot of that very limited income on just a place to live. And this doesn't even begin to address transportation to get back to see their primary care provider. What a difference this would have made, Jane.
Yeah, thanks so much, Linda. I want to show you another information that you can get from the dashboard. So in addition to the comparisons on the dashboard, you can see more detailed breakouts by demographics such as age, race, ethnicity, gender, or health insurance. So we're showing a topic that we're hearing a lot about right now, heart failure readmission. The visualizations make it easy to spot that males, those on Medicare, and African Americans have higher readmission rates than the overall group in the zip code. Linda, what does it mean to you to be able to see this kind of detail for these indicators?
Well, Jane, this level of detail that is that easy to get to, a simple click, So now, if I'm planning discharge for my patient, I can really say, this patient, because I know he's in this high-risk group for readmission, maybe the person I pick out for this particular diagnosis for a transition coach post-discharge. I only have a certain number of people assigned to be transition coaches, but now I know what my priorities are, and I can move forward with best utilizing those limited resources that I have.
Yep, absolutely. And finally, indicator pages can also show information by location. As Linda said, your zip code is a better predictor of health than your genetic code. So one of the most important ways to look at your data is by location. This is a map of heart failure readmission ratios by zip codes. Areas in red and yellow are those with higher ratios compared to county benchmarks, while those in green are doing better. Looking at the map, you can easily spot areas that are at higher risk based on where patients live. I'm going to change gears a little bit and talk about some additional insights CommunityVision can provide. We know that while you'll have access to more than 500 community indicators, it's still really helpful to synthesize those data points into a more digestible value. CommunityVision offers 2 health equity indices, a socio-needs and a food insecurity index. The socio-needs index shows areas of increased socioeconomic needs correlated with poor health outcomes. And the food insecurity index is a measure of food access correlated with social and economic hardships. For both, the darker colors indicate areas of increased need, and both indices are available down to the census tract level. So let's take a look at how these indices can help you put your hospital data in the context of social determinants of health. I'm now showing again the map of heart failure readmission ratio by zip code on the left, and areas in red and yellow are those at higher risk for readmission. The map on the right shows the socio-needs index we just discussed. Zip codes in darker blue have higher index values correlated with poor outcomes. From this, we can see that both zip codes 75019 and 75216 are at higher risk for readmission, but 75216 is also at risk based on socioeconomic needs. Linda, I'd love to hear how a hospital system could use these insights to improve their care and outcomes.
Absolutely, Jane. And looking at this from a clinical standpoint, I can see that if I went in and said, well, you know, those patients in 75019, you know, I can't really do much for them post-discharge. Well, they don't really have a high social need. So planning for extra transportation or planning some food areas wouldn't help that. But if I look down at 75216, wow, they have a great social needs index. So me giving them an appointment to come back to see a primary care provider, and they don't have transportation and probably don't have the money even for bus fare, that's not going to work for them. So I am setting them up for failure because, you know, patients, just like the rest of us, they don't want to be in the hospital. They don't want to be readmitted. But so much of this is not simple as handing up a prescription and a set of instructions at discharge. We really have to be able to see this whole picture to understand, Jane.
Yep. And I think this really points to the need for community interventions that can help improve health in the community before patients come to your doors and after discharge. So you might be asking yourself, well, how would we know which community interventions work? CommunityVision includes a library of more than 2,300 promising practices that can address a range of identified community health needs. These are practices that have been evaluated and show positive outcomes. You can search the library using keywords or filter based on your target population or geographic type. I like to think of it like an Amazon shopping experience for promising practices. Each promising practice has a full description and points you to where you can get more information. And I'll say I can attest that I came from a health department that used this tool, and it was incredibly valuable for us. Our staff actually used the library to make sure that they were using evidence-based practices, and if not, they used it to find a practice they could implement. Some of the programs here have contact information listed, and I've actually been able to communicate with folks in other parts of the country to ask them about their experience and even get their curriculum or evaluations so I could tailor them for local use. And we know even with all of this at your fingertips, maybe just having this information on the platform may not be enough. You might still need assistance understanding which strategy is best and how to move forward with implementation. HCI has a team of consultants who specialize in community health and can provide guidance on strategy development to make sure that the investments you're making within the hospital walls will be reinforced by your community health strategies. Finally, we knew we couldn't end this webinar without discussing the topic of health equity. As we look at what's been on the news and the world around us, this topic of equity is ever present, and healthcare is no different. Not only is working towards health equity the right thing to do, it is the key to long-term growth. We at HCI are often asked, where do we start? Well, we often start with data because that's how we begin to understand a problem and know where there's progress. But here are some more specific ways to look at the data and convert it into action for health equity. Invest in building a deeper understanding of the social determinants of health or the conditions your patients live, work, and play. This will help you better understand their impacts on your patient population. Look at both clinical and community health data to create a more holistic picture of your patient's health, and examine that data by gender, race, ethnicity, or neighborhood. This can illuminate how disparities in outcomes are tied to structural inequities. And finally, once you've deepened your understanding of your patient population on these levels, deploy interventions at all levels where they matter. That includes clinical interventions at the individual level, as well as group and policy level interventions that will have real and long-term impact on the communities your patients come from. CommunityVision provides you with so much of what you'll need to move forward on health equity, and we at Conduent are excited to meet you in this moment and make strides in this area together. With that, I'll turn it back over to Linda to wrap up this webinar and take any questions you have.
Thanks, Jane. So let's look at this solution for your long-term growth, how we move ahead now and in the future by addressing those at-risk populations, by understanding the patients and their health ecosystem. Now we can begin to lower those readmission rates. We can begin to improve that quality of care. Not only that, but we can base our strategies not just from our limited view of data of what's happening inside, but moreover, what happens to them post-discharge, looking at the total visit, those 30 days after discharge, that are driving a lot of those penalties, because now you're going to have that sight of what happens outside your walls. We're going to gain insights about our strengths. We're going to gain insights about where can we grow our business and move forward and be able to reduce the overall cost in our community for healthcare while increasing our market share. And let's not forget about health equity. I think more now than ever in the last year and a half, while we've all been so focused on COVID has been catastrophic, but it has brought a lot of attention to both our leaders at a national and local level in understanding how these inequalities in community, in services, and even in the healthcare we provide, create issues like these pockets that we see out there of very high COVID transmission rates and inability to receive equitable care. The inability that we have to provide even something as simple as vaccine coverage, to be able to identify what communities have the greatest need that are not going to be able to have transportation to get in to these big vaccine clinics we're running on site. How we can understand what those real root causes are. How we can utilize this evidence-based practice to begin to address those inequalities. How do we then reach out to our leaders to help us look at some of that new recovery effort that they have out there, and possibly some of that funding to help us begin to see those long-term benefits and increase that multi-sector partnership. Reach out past just healthcare into the rest of the communities out there that now have a clearer picture of how those health inequities are really driving the cost of healthcare throughout. So let's go back and let's kind of wrap this up and look at some of our key takeaways. We need to get the right data to drive those strategic and equity-based investments for that value-based care reimbursement, because that's how we're being paid for health care now. Use that solution that lets you merge that acute care quality and community data together to let you look outside the walls of your hospital, through the windows, to the community where that greatest impact on overall health is. To be able to realize and proactively address the impacts of those social determinants of health. Don't wait until those penalties are at your door. Begin to realize what the community you serve really looks like, where the needs are, and where you can provide the services to be able to bring overall health, to be able to lower the cost, and then also to be able to increase your market share and drive your ability to stay financially stable as a healthcare provider in your community. To be able to plan that long-term growth, not just how do we get through this month or this quarter, to be able to look long-term at these things. So I really think we've talked about where we are, we've talked about our challenges, we've talked about a solution today and how we can take that solution and arm in arm, we can help you address things that you may feel like that are beyond your control by using our advising, by using our wonderful library that's included in CommunityVision, by what are some of those workable solutions for you that you can apply to your community.
And this brings us to the end of our presentation. Everybody have a wonderful day.